So the question comes up, why did I get a splint instead of a cast? And also the question comes up, what's the difference between a splint and a cast? And that difference is basically that both of these are hard materials. It's either plaster, fiberglass, and there's some other synthetic materials now. But there's a hard material that supports an extremity or area that we've repaired. In the case of a splint, it's just not circumferential. So the difference between a plaster splint would be you have a slab of plaster on one side of the joint, and there's cast padding and it's wrapped with an ace wrap. A plaster cast would be circumferentially wrapping the extremity. And the same applies for fiberglass or any other material. That's the difference, basically, that you're not going around the extremity. And the importance of that is that immediately after surgery, in many cases, there can be a lot of swelling, and it can lead to a situation where if you're not keeping the extremity elevated, that you get some tightness and cutting off of circulation. And so in order to avoid that, in many cases, we use a splint instead of a cast. Very often children would prefer a cast, and sometimes we do a cast and we may what we call bivalve it or have some areas to relieve some of the pressure. The cast is definitely more aesthetically pleasing, and in children definitely it's more fun to have a cast on. But realize that there are reasons why we do this, and so whether you get a splint or a cast, functionally it's the same thing, and ultimately it's to protect any repair that we've done.